clarify why the system to notify people in hotspot areas about the pop-up clinics doesn't appear to be working. The overwhelming majority of people who actually live in those communities that we're hearing from were not told about these clinics, even though they had all registered online prior. So were emails sent? Was it text messages, phone calls? Can you say how many people residing in those areas were actually notified?
No, I can't give you those details. Obviously, the operational details are what Fraser Health does, and I know they reached out through specific community groups and others. And yes, we do know that things spread very quickly on social media from certain people, and that happens. And it is the challenges in a large urban area like that, which are different from smaller, less populated areas. So I know that they are regrouping and looking at what worked and what didn't work. I know next week we are looking at some of the outreach through Gurdwaras, for example, and there will be continued to be different ways to outreach to different communities. And I think the really important thing that you mentioned is, people, the registration is the way that you will get a guaranteed vaccine in your clinic, and we need to find ways to answer people's questions. And that was one of the discussions that we've had in several different communities where there's a lower rate of registration. Is, what is that? Is it because people don't know how the system works, don't know where to go to do that, or is it because they have questions and they're not ready yet to commit to being part of the immunization program? And that's something that I'm going to be looking at and working with colleagues across the province to make sure we're doing it in the right language, in the right tone, answering the right questions, and doing better at that to encourage people to get into that stream of getting immunized as quickly as we can. So there's still many, many things to learn as we go through this, and It's Our Shot is one of the programs that is designed to reach out to different communities, and we want to be part of that as well. Looking at, how do we engage with people who know their community a little better to find out what the barriers are and remove those barriers. And so there will be more experiments as we go through this, and as more vaccines available, and we get it to more and more people across the province. And can I just say, before I turn it over to Minister Dix, I forgot to mention as well that our Speak survey is out there still. We've had about 150,000 people who have answered it so far, but this is the second survey that we've done to ask just these questions. What are the things about the pandemic that have affected you and your family? And we know the first survey, over 400,000 people answered, and it was very helpful for us in understanding the impacts that the pandemic, as well as the measures we've put in place, have had on people. So particularly, I want to ask people living in rural and remote areas, men in particular, under the age of 35, so young men, people 75 and older, and anybody from different ethnic groups around the province. Please answer the survey. We want to hear from you, and help those elders and seniors in your life answer the survey as well, to share their stories. And it's on the BC CDC website, the COVID-19 survey, and I encourage everybody to take part in that and tell us your story. Thank you.